Now we're going to look at New South Wales, but first I just wanted to mention this uplifting news at the top that after everything it's been through over the last 18 months, Victoria has had a 0 day. And we'll get to that in a moment after going through the challenges facing other states right now. So this Sydney COVID outbreak is into its 8th week now, and new daily case numbers have levelled off over the last week around the 200 mark as an average. But the Premier finished off that media conference yesterday saying we just don't know if we're through the worst of this yet. So 5 million people are still in lockdown and the number of exposure sites keeps growing, with so many new cases out in the community while infectious. Another unit block has been locked down in Sydney, this time at Campbelltown in the southwest, after several residents tested positive for COVID. It's not known just how many residents have contracted the virus at this stage. So before we go to our reporters, let's take a look at a few maps and graphs. So this first one shows the number of exposure sites in very roughly defined areas. So these are spots where there's been a COVID positive person and the chance of transmission to others, places like supermarkets, restaurants, workplaces. This is just Sydney, and this is the first time in this kind of last few weeks as we've been showing you these numbers that there have been 2 spots with over 200. So in these aggregated areas, and you can see the biggest number, 214 in that broad area from Blacktown in the north through Parramatta to Cabramatta, and then closer to the city, that 202 number in a broad area again, covering from Ryde in the north, south through Canterbury and Campsie, south to Kingsgrove. 53 is further south from Liverpool, including suburbs like Casula and Ingleburn. The next map at the top, the total number of positive cases in this outbreak so far, and that will no doubt burst through 4,000 today. So this shows where positive cases live in the health districts of Sydney. These are larger areas that can include dozens of councils, and these are cases detected just in the last 4 weeks. So some of the earlier cases are now being deducted from these numbers as the outbreak continues into its 8th week now. And so this southwestern district of Sydney, which starts south of Parramatta and goes through Liverpool and Campbelltown to the Southern Highlands, 1,720 people there now with COVID. The western district, which includes Parramatta and extends north, has 743 cases. The inner west, 508, and there have been 15 deaths so far. And if we zoom in to show a few of the council areas that have big numbers of cases, Fairfield, that number is actually down 1 on yesterday because these numbers here are also cases just in the last 4 weeks. So some of those earlier case numbers are dropping off from these. So the biggest jump yesterday was in neighbouring Canterbury Bankstown, up to 708 cases now. And there's been a marked increase in that. A couple of weeks ago, that was a quarter of what the case numbers in Fairfield were, but now that's up to 3/4 of what that Fairfield number is. Liverpool has 305 cases, and some of those other council areas with those tighter lockdown rules, Cumberland at 400, Blacktown at 220, Parramatta 97, Georges River 101, and Campbelltown, where we're going to go to speak to a reporter in a moment, up 14 from yesterday to 122 cases. And this last graph shows what's happened with case numbers over the past few weeks in New South Wales. So the last 8 days have been the biggest numbers so far through this outbreak, and the yellow portion of these bars are the numbers in the community while infectious. While it looks like that number has been decreasing or levelling off, there's a big question mark over that because of the number of cases that authorities just haven't worked out at the end of each day what their isolation status was. Yesterday that number there is 82, but if you add the yet to be determined factor in that, it's actually closer to 130. And so that key media conference no doubt today will be at 11 o'clock with New South Wales authorities, and we'll get more detail there. So let's go now to reporter Nakari Thorpe in Sydney and Cecilia Connell in Campbelltown in Sydney southwest. Nakari, we'll start with you. What can you tell us about vaccine targets?
Yeah, good morning, Joe. Well, yesterday the Premier, Gladys Berejiklian, set a target of 6 million doses by the end of August, if there's any chance of restrictions easing in this greater Sydney lockdown. At the moment, there's about 3.9 million doses that have been administered across the state so far. So we need another 2 million to be able to reach this target. So 6 million doses means that about 50% of the state's adult population would be vaccinated. Gladys Berejiklian says reaching this target would mean it would give her government more options as to what life would look like beyond August, when this current lockdown is scheduled to end. She says it is an achievable target going by our current vaccination rates, which is about 500,000 per week. But she has warned that it doesn't mean a guaranteed ticket to freedom at this stage, but it could mean an easing of restrictions.
And Nakari, there are 8 council areas in Sydney at the moment that are facing increased lockdown rules compared to other spots. What's the concern about the leakage from those areas, or the spread of the virus from those lockdown LGAs to neighbouring council areas?
Yeah, well, Joe, yesterday New South Wales recorded 199 new cases of COVID-19. At least 50 of those were fully infectious in the community. And again, the bulk of these new cases are really still circulating in Western and South-Western Sydney, in those 8 local government areas of concern. So the New South Wales Chief Health Officer, Dr. Kerry Chant, is warning people to not go into these local government areas unless they absolutely have to, because the virus is creeping into surrounding local government areas, and that includes Strathfield, Burwood, the Inner West, some suburbs within the Bayside Council, Penrith and Camden. So Dr. Kerry Chant is warning residents in those regions to remain vigilant and to not be complacent. And now, Joe, I just want to show you where I am today at the Sydney Olympic Park vaccination hub. And as you can see behind me, there is a long, steady stream of people lining up to get their COVID jab. And this really is what the New South Wales Premier and health authorities want to see. They want to see people coming out to get their vaccine to really be able to ramp up and reach the state's target.
Okay, Nakari Thorpe there in Olympic Park in Sydney's west. Let's head a bit south now to Campbelltown in Sydney's southwest. Cecilia Connell is there. Cecilia, what can you tell us about this unit complex?
Joe, the unit complex has been locked down after residents at the complex on Warby Street here in Campbelltown tested positive to the virus. Now, it's not yet known how many residents have tested positive, but at the moment, all residents in the 5-storey building are being tested, and they're going from household to household doing those swabs as health authorities try to contain the virus here. Police have been on site since about 8 o'clock last night, Joe, standing at the entrances just to make sure that residents are staying apart and that those tests are being conducted. I spoke to a few of the officers this morning and they said they were here in a supportive capacity with health authorities. Joe, I also just spoke to one of the residents here over her balcony. She said that they received an email yesterday afternoon alerting them that there had been positive cases identified in the building. She said that her family have been tested and they're now awaiting their result, but they've been told that they obviously can't leave their unit until a negative result is received. So health authorities definitely keeping an eye on this situation. As we've been hearing, they've been concerned about transmission through households. So this is one that has them on high alert, Joe.
And Cecilia, what's happened? We just mentioned the numbers of exposure sites. We haven't kind of mentioned the broad number, but we've been having a look at those exposure sites each day, and it was kind of notable today to see 2 of them above 200. What's happening overall with the numbers of exposure sites?
Look, more than 180 have been added overnight, Joe,
wow.
And that list is continuing to grow as you would expect, as the numbers sort of generally remain in terms of new cases around the 100 to 200 mark, but most concerningly, the number of people infectious in the community. So yesterday there were 50 people in the community infectious for their entire period, a further 32 for part of that period, and the isolation status of 47 remains under investigation. So I guess that gives a little idea, Joe, as to why this list continues to grow. One of the venues added in the last 24 hours, the Woolworths at Bankstown, 4 staff members who worked at that Woolworths store between the 22nd and the 31st of July have tested positive. That store's now been temporarily closed as it undergoes a deep clean. Many venues across Sydney's west and southwest, Ryde, Brookvale, Campbelltown here, have been added to that list, and health authorities are urging people to remain updated as you can understand, venues are constantly being added.
Okay, we'll leave it there for the moment. Cecilia Connell in Campbelltown in the southwest and Nakari Thorpe in Sydney's west at Olympic Park. So I just mentioned once again, we're expecting that key media conference from New South Wales health officials at 11 this morning Eastern time, so in about 2 hours' time. We'll bring you that live here on the ABC News channel. And we've just had confirmation that the Queensland media conference this morning, the COVID update, will be held at 10 Eastern time, so in about 50 minutes' time. And we'll bring you that live here on the ABC News channel. So locations in far north Queensland have been added to the list of COVID-19 exposure sites, with a person in Cairns returning a positive test result yesterday. Meanwhile, Brisbane Grammar School has confirmed more positive cases overnight, with 5 students, 1 teacher and 1 parent now infected with the Delta strain, as the state's southeast reaches the halfway mark in the current lockdown. Before we go to our reporter, let's take a quick look at what's happened with the cases there in Brisbane over the last 5 days or so. So that first case was that student at Indooroopilly, popped up on Thursday night, then 6 cases on the Friday, 9 on the Saturday, 13 on the Sunday, and up to 16 yesterday. And the Queensland Deputy Premier Stephen Miles is due to hold that media conference at 10. Okay, let's go to our reporter now, Jessica Rendell. She joins us from a drive-through testing clinic at Toowong in Brisbane's inner west. Jessica, so first of all, head way north, a couple of thousand k's north of you. What's the latest on this Cairns case?
Good morning, Joe. Well, the Cairns case is pretty interesting because health authorities aren't sure if it's a historic case or not. So investigations are being conducted there. Some serology testing is underway. In the meantime, they have released some contact tracing locations for Yorkeys Knob, Trinity Beach, as well as Cairns City. One of those locations includes a childcare centre. That's now been closed for deep cleaning as well.
And what's the latest on the Brisbane outbreak?
Yeah, so here in Brisbane, we're hearing that there are some more cases expected to be announced linked to the Brisbane Grammar School. There are currently 7 cases linked to that school now. So that's 5 students, a teacher and a parent as well. So we're hoping that today those case numbers aren't too high, but they have been increasing over the last few days. So let's hope that by Sunday we can get this pretty much under control. I'm at a testing clinic here at Toowong. The queues are pretty massive. There are about 70 to 100 cars that have been lining up here. I've been here since around 8 o'clock this morning and the queue is only just growing. It's pretty slow moving too, so it looks like these people will be spending almost all day here. Now, there are a lot of people in isolation due to this latest case. That includes more than 400 healthcare workers as well that are now in isolation, as well as 4 cardiac surgeons linked to the Brisbane Children's Hospital. So it's putting quite a strain on our healthcare system, and let's hope that all of these people being in isolation means that the spread will stop pretty soon.
Okay, Jessica Rendell reporting there from Brisbane. And just repeating that, the Queensland Media Conference at 10 o'clock this morning. We'll bring you that live on the news channel. And I just want to go back to the Sydney situation for a moment, because I was contacted by a couple of Central Coast viewers yesterday, the Central Coast of New South Wales, just to the north of Sydney, that Gosford area, saying why weren't they on the maps there? And I said I was going to include them today, and I didn't. I'm sorry about that. But the number of exposure sites there in that Gosford area, around 18 at the moment. Very few compared to the hundreds and hundreds in the Sydney region. But Gosford is part of that lockdown area, extends a couple of 100 k's along the coast there, all the way from Shell Harbour in the south up to Gosford in the north. The Premier's been asked about what's happening with those areas with the continued lockdown. Is there any chance they could come out earlier if things get better? She's said up to now that she's keeping a close eye on the situation, but no indication of that just yet. Now, Victoria, let's head south to some brighter news, has recorded its first day without a new locally acquired case of COVID in almost a month. Reporter Steph Ferrier joins us now from Melbourne. Steph, g'day. So, yeah, some wonderful news there for Victoria this morning.
Really fantastic news for Victorians here. This is the first day that we've had 0 new local cases since July the 11th, since before this latest outbreak. So we are very pleased here at the moment. And also, importantly, the number of active cases has fallen below 100 for the first time in a little while as well. So that's now down to 99. This is off the back of some 30,117 tests that were processed overnight. And so we are really looking in great shape at the moment here. We also have seen that our exposure sites as well have fallen down to about 45. They were up to about more than 300 at the peak of this outbreak. So we are seeing that fall as well, which is really great news too. And we haven't seen a new exposure site listed, in fact, since Saturday.
And so what does this mean for restrictions?
Well, you'd have to hope that obviously this is really great news. We are really going well, and in fact, Brett Sutton himself even tweeted on social media a really great tweet of the 0 new cases, just with a shot of Ariane Titmus's coach there, Dean Boxall, just going completely bonkers in the stands when he saw her win one of her gold medals. So he is no doubt very pleased with this news. However, unfortunately, he did say yesterday that we really did need to make sure that we completely drove down this outbreak completely, that it was going to be a bit of a tail end in these cases that might continue for another week or two. And that's because we still have around 3,000 primary close contacts that remain in isolation at the moment. Around 90% of them have been cleared, which is great news, but there is always the possibility that we're going to get the odd positive case coming up as they get to their day 13 tests. So we do know that he has said that he is ruling out coming up with any eased restrictions until Tuesday next week, because that will mean that there's the full week of data for them to be able to have a look at as well. So that was specifically when someone asked him in the press conference whether or not, for example, we could have any visitors to our homes, because that is still banned. And I dare say that the mask use both indoors and outdoors being mandatory is going to stay with us for quite some time to come as well.
And Steph, where's Australia at in terms of getting involved in mRNA vaccine production?
Yeah, so we have heard from our Nobel Prize winner, Peter Doherty, who obviously is the namesake for the Peter Doherty Institute that came up with all the modelling for the numbers of vaccinations. And he has really thrown his weight behind us setting up a vaccine, mRNA vaccine industry here in Victoria, because he says that Victoria is best placed to do it. We have the biomedical experts here and all of the facilities at the moment. CSL obviously is producing the AstraZeneca vaccine right here at the moment, and he does say that this would be much better than what we're currently doing, which is just constantly digging stuff out of the ground and selling it that way, that we need to set up one of these smart industries here. And once we did that and had the facilities, it would be very easy for us to be nimble in the way that they could easily flick the switch and change it from a COVID-19 vaccine to another vaccine, because this technology can be used for a host of other diseases and vaccines as well. So for prevention of various things, just as long as they change that code basically in the mRNA. So he does say that this is something that is really sorely needed. We've already seen the Victorian government put $50 million on the table, and the federal government look for expressions of interest, and this is what he had to say about setting up right here in Victoria.
We need to be prepared for the future and what this virus is going to do and what other viruses are going to do. So mRNA vaccines are a great way to go.
And so he does also say that we are going to be seeing the COVID-19 situation for some time to come. So he is very pleased to see that children have also been authorised by ATAGI to be able to get their vaccines when they become eligible as well.
Okay, Steph Ferrier reporting there from Melbourne. Australians are expected to soon have more options about where they can get their COVID vaccine from. The military figure in charge of the rollout says his goal is to ensure everyone gets at least one dose by the end of the year. Political reporter Steffi Boris joins us now from Parliament House in Canberra. Steffi, g'day. So let's start with a timeline of the vaccine rollout. Where are we at?
Good morning, Joe. Well, the plan is to get 80% of the Australian population above 16 fully vaccinated. When we'll reach that, that of course is the million-dollar question, and there's a couple of different plans and timelines that have been put out into the public, so we'll take a look at those today. The main one being the National COVID Vaccine Plan that's been issued by the federal government. It says in the report specifically that the plan is for every Australian to receive at least the first dose of the COVID-19 vaccine by 20 of December. We've heard today from Lieutenant General John Fruin. He says he's confident that most people will be fully vaccinated by the end of the year, but then he was pressed on whether that will actually reach the 80% target, because we do know from research that there's 77% of the population that's willing to get vaccinated. So there is a level of hesitancy still within the community, and that's something that obviously still needs to be addressed. But speaking this morning, Lieutenant General John Fruin says he's relatively confident at least that 70% target could be reached by the end of this year.
I think we've got a really good opportunity to get to 70% this year. But as we've seen from international experience, getting above 70% does require concerted effort. So we'll work hard to get to 70% this year, and then if we can get further than that, that'll be great. What I'd really like to see as we get later into the year is the maximum convenience available for people in Australia to get vaccinated. So we're intending to keep looking at all of these sort of alternatives and then getting the arrangements in place.
John Fruin there. So Steffi, what are some of those alternatives?
Yeah, well, at the moment, Joe, you can go and get your vaccine at a mass vaccination hub, your GP or a pharmacist, but the options there are going to be expanding. The reason being, as Lieutenant General John Fruin said there, is this is all about trying to make it easier and really convenient for people to get the vaccine as those supplies ramp up. So drive-through clinics, we know that they're currently working as testing drive-through clinics, but they'll be changing to vaccine drive-through clinics later this year, with a pilot program setting up as early as September. They're seen as a priority in terms of different ways that the vaccine rollout can proceed. Apart from that too, we do know that workplaces are really keen to take part in the vaccine rollout. This is already taking place with Woolworths and Westpac in Sydney's west and southwest, where we're seeing that outbreak, but there's discussions underway about making it a more nationwide program later down the track. And of course, we've heard about that whole concept of having a Bunnings sausage sandwich and getting a jab at the same time. Plans are still underway for that potentially to happen, maybe around the October mark. So this shows that these different options are coming into play when supply is ramping up. Now, aside from that, it goes back to that hesitancy and the willingness of Australians to get the vaccine. We understand that there'll be a new advertising campaign later this month and further advertising campaigns later on in the year too, to try and make sure that everyone in Australia knows what their options are and why they should be getting the vaccine.
And Steffi, we're nearly 6 months into the rollout now. When will people under 40 get access to Pfizer?
Yeah, this is a really interesting question, and one that was addressed by the Doherty Institute. They, of course, were asked to provide modelling to the federal government about these vaccine targets. And what they looked at specifically, as well as the vaccine targets, was people under the age of 40 and the need for them to get vaccinated, because in the end, they're seen as the people that transmit the virus more so. The reason being is because people under 40 are seen to be more social, they hang out in larger groups, and also they often take on jobs where you can't work from home. They are customer facing, so to speak. So this Doherty modelling did suggest that the government needs to move towards a focus of vaccinating people under the age of 40. We know now from the federal government's plan, its intention is to give Pfizer to people between 30 to 39 from September, and then Pfizer should be made available to people between 16 and 29 from October. Keeping in mind that younger cohort is eligible to get AstraZeneca at the moment, but if they want that option of Pfizer, they still have to wait just a little bit longer.
Okay, Steffi Boris there in Canberra.